tutorial will provide information on types of inhaler devices, inhaler techniques, and some general information regarding inhalers. In terms of devices for treatment of asthma, a wide variety of devices are available. As regards to which one is appropriate for the patient depends on age, socioeconomic status, and other comorbid factors.
Knowing how to use your inhaler device correctly is very important. Using the device properly will deliver the medication into your lungs effectively. This needs practice. Incorrect technique may lead to deposition of medication on your mouth or throat. Always take the inhaler to your healthcare provider and ask your healthcare provider to watch you using the inhaler and make sure that you are following the proper technique.
Metered dose inhaler. When using a metered dose inhaler, you need to coordinate actuating the inhaler with inhaling the medication. The metered dose inhaler often needs to be primed before using for the first time or if you haven't used it in the last 2 weeks. Priming simply means spraying a number of doses into the air, away from your face. Check the leaflet that comes with your inhaler for further information on priming. When you are ready to take your medication, first remove the cap from the inhaler. It is important to look inside to make sure there is no debris that you may accidentally inhale. Then shake the inhaler well for 5 seconds. Hold the inhaler firmly by placing your index finger on top of the canister and thumb on the bottom of the mouthpiece. Sit up straight or stand up and tilt your head back slightly. Exhale away from the inhaler. Put the inhaler in your mouth. Your lips should be sealed around it. Press the inhaler and start breathing in at the same time. Take a slow, deep breath. Remove the inhaler from your mouth and hold your breath for 10 seconds. Exhale slowly through your mouth. If another dose is required, repeat the above steps after 1 minute. Wipe the mouthpiece with a clean, dry cloth. Replace the cap and store safely within the protective covering. Usually, the metered dose inhaler contains around 200 doses. You can count down the number of doses you take to find out whether the metered dose inhaler is empty or not. You should keep the metered dose inhaler in an easily accessible place, but should be out of reach of children. You should store the metered dose inhaler in room temperature and be aware about the expiry date on the canister.
As you already know, this is a metered dose inhaler. This can be used with a spacer device. Spacer or holding chamber is a transparent device that holds medicine in place so that you can breathe them easily, and it helps effectively deliver medicine into the lungs. A wide variety of spacer devices are currently in use. This is a volumetric spacer, which is impractical due to its large size. Currently, this modern spacer device is becoming more popular due to its smaller size and portability. These two are spacers with face masks. This device with a smaller face mask is used for children less than 2 years, while the other is used for children above 2. There are several advantages in using a spacer device. When using a metered dose inhaler alone, it needs hand-brake coordination, meaning that the patient has to inhale just as the spray of medication is being released. Spacer device eliminates this need for hand-brake coordination. Therefore, this method is suitable even for young children. Another advantage is that it reduces the amount of medication deposited in the throat and mouth, leading to less side effects such as fungal infections and voice changes. When you require a dose of medication, first remove the cap from the bottom of your metered dose inhaler and shake the inhaler well for 5 seconds. Now insert the metered dose inhaler to the open end of the spacer. Ensure inhaler fits properly. Now remove the cap from the spacer. Sit up straight or stand up and tilt your head back slightly. Take a normal breath and breathe out fully. Place the mouthpiece between your teeth and seal your lips tightly around it. Push down on the canister once. Take a slow, deep breath. Now take the spacer away. Hold your breath for a count of 10. Now slowly breathe out. Goal is not to hear a whistling sound. If you do, it means you are breathing in too fast. If you need to take more than one puff, wait 1 minute and remove the metered dose inhaler. Shake it for 5 seconds and follow the same steps again. After using the inhaler, replace the protective coverings. Rinse your mouth with water or brush teeth after you get your controller medicine, such as inhaled steroids. When taking treatment for asthma, medication can be administered through metered dose inhaler, as you've seen before, or through a dry powder inhaler. Cyclohaler is a dry powder inhaler. It's a breath-activated device, which means medication is being released when you inhale. Now let's see how to use the cyclohaler. First, remove the cap of the device. Open the cyclohaler by turning the upper part in the direction of the arrow. Take the capsule and insert it into the device. Then close the cyclohaler until it clicks into place. Sit upright and hold the inhaler vertically. Briefly press the 2 blue buttons at the bottom end to puncture the capsule, where you will hear a cracking noise. Now take a deep breath and breathe out fully, but not into the inhaler. Put the mouthpiece into your mouth and close your lips tightly around it. Now inhale through your mouth as rapidly and deeply as possible, whereby a buzzing sound will indicate the correct inhalation. Then take the cyclohaler out and hold your breath for 10 seconds. Then breathe out slowly. Remove the empty capsule from the inhaler by opening the lower part of the cyclohaler. If medication is still left inside the device, inhale again as described previously. If you need to take another dose, wait 1 minute and follow the steps again. Wipe the mouthpiece with a clean dry cloth and replace the cap. Do not use water to clean the device. After using a corticosteroid, remember to rinse your mouth with water. Rotahaler is a dry powder inhaler. It's a breath-activated device, which means medication is released when you inhale. Using the Rotahaler is exactly the same as using any other inhaler. First, hold Rotahaler vertically. Insert the transparent end of the capsule into the square-shaped opening. Press the capsule down so the upper part of the capsule comes level with the opening. Now, hold the upper part of the device and turn the lower part anti-clockwise. As you turn it, the capsule will be split into 2. Put the mouthpiece of your Rotahaler between lips and teeth and seal it. Tilt your head slightly backward and breathe in the powder quickly and deeply. Remove the Rotahaler from the mouth and hold your breath for about 10 seconds. Now, slowly breathe out. While you breathe in, you will hear a whistling sound. This will indicate that your technique is correct. If some powder is still left in the device, inhale again. If you want to take another dose, follow the above steps again after 1 minute. Now, open the device and discard the empty capsule. Clean the mouthpiece with a clean cloth when it appears dirty or at least once a week. Do not use water. After using corticosteroid, remember to rinse your mouth with water.
This is a Diskus Inhaler, which is a breath-activated device, which means medication is released when you inhale. It is a form of dry powder inhaler. First, hold the Diskus level with one hand. Place the thumb of the other hand on the thumb grip. Push your thumb away from you until the Diskus clicks. Now you can see the mouthpiece. Hold the Diskus level and slide the lever away from you until the Diskus clicks. This will load the medication. Next, hold the Diskus level and away from your mouth and gently breathe out. Never exhale into the device. Seal your lips tightly around the mouthpiece. Breathe in rapidly and deeply. Remove the Diskus from your mouth and hold your breath up to 10 seconds and then breathe out slowly. If you require another dose, pull the lever back and push it out again to load the second dose, and then use as mentioned before after 1 minute. When you are done, close the Diskus by replacing the thumb grip. Always rinse your mouth with water after using the Diskus for steroid medication. The Diskus has a dose counter on top of the device. It will let you know how many doses are left. As you use the Diskus, the number will gradually decrease and it counts down to 0 when the Diskus is empty. To clean the Diskus, do not put it in water. Simply wipe the mouthpiece with a clean cloth when it appears dirty, or at least once a week. Now, let's see how the metered dose inhaler could be used for children. For this, you need to have a spacer device with a face mask. Remove the mouthpiece cover from the metered dose inhaler. Shake the inhaler for 5 seconds. Insert the inhaler into the inhaler holder of the spacer device. Place the face mask gently and securely over the baby's nose and mouth. Hold the device at an angle so that it is comfortable for the child and yourself. Press down on the canister once to release a puff of medication into the spacer. Keep the face mask over the nose and mouth until the child has taken at least 6 to 10 breaths, which usually takes about 15 seconds. Look at the movement of the valve to confirm that the baby is properly breathing in and out. If more than one puff is needed, repeat the above steps after 1 minute. Remember to wipe the baby's face after administration of inhaled steroids. After using the device, store safely in the protective covering.
You may have a spacer with a mouthpiece or spacer with a face mask. Whichever kind you have, it is important to clean the spacer. Follow these steps to clean the spacer. First, wash your hands thoroughly. Use warm soap water for cleaning. Separate the parts of the spacer and soak them in soapy water for 15 minutes. Now rinse with clean water. Do not scrub. Then let them air dry. Do not expose to direct sunlight. Never wipe the inside of the spacer. If needed, clean only the mouthpiece with a clean dry cloth. Cleaning once a month will be sufficient. But if you use the spacer daily, clean once in 2 weeks. Never soak the metal canister in water. You should renew your spacer every 6 to 12 months.